Hi, my name is Lydia, and today I'm going to be telling you about my practicum experience at the Nutrition Care of Rochester. First, I'm going to give you some background as to the facility, preceptor, and clientele. The facility itself is a private practice called the Nutrition Care of Rochester. It's located in Pittsford, New York. The owner-operator is Amanda Ronzo. She's an MS-RD. She has her CLC, which is Certified Lactation Consultant, and CDN, which is Certified Dietitian Nutritionist. And since she's the sole owner-operator, she pretty much does everything. So she's the sole dietitian working with the clients, she's the business manager, and she works with the administrative roles like billing, paperwork, and working with the insurance companies, and marketing, so social media, websites, and blog posts. The day-to-day activities are to see clients, and that generally looks like her chatting with the client for a little while, writing a note, sending that note to the doctor, submitting the bill to the insurance company, and filling out a diagnosis and treatment plan if it's their first-time client. Then she gets up to date on billing. It's really easy to fall behind and really tricky to catch up, so it's easier to just keep going on that. And then filling out Excel spreadsheets for reimbursements, returning calls and referrals from doctors, and then also if she has time to work on creative work, she does that, but she usually doesn't have a lot of time to do that, and that's where I came in. That's where I did a lot of my work for the practicum. The service information, in 2019 she served 92 clients. The majority of people are local, although there are some people from Buffalo and Saratoga Springs that have come to see her. People generally come from a doctor's referral, or they come on their own. People with a doctor's referral come for lots of different reasons. If they're adults, they come in for diabetes, high cholesterol, and obesity management. If they're 20 to 40 years old, they usually come in for like IBS or a celiac diagnosis or a new diabetes diagnosis. With children, oftentimes it's about overweight or obesity issues, allergies, or picky eating. And the people who come on their own have really tried everything except for talking to a dietitian. The fertility issues are really common with this, prenatal nutrition, weight status, and families with kids that have picky eaters. And the cost for a service is $140 an hour, and usually everyone pays with insurance. Since Mandy is the sole operator of the private practice, there are some advantages and disadvantages to this. Some advantages are that she gets to do everything. She likes to be hands-on, and she likes that her personal expectations are always met when she does something. However, she has to refer some people to other professionals if she feels like she can't best serve them. So one way that she wants to improve on this is that in the future she'd like to hire more dietitians with lots of different backgrounds so that she can handle more the administrative end, but they can also serve a wider range of people. So in terms of interacting with other health services, Mandy is a board member of the Healthy Baby Network. They have bi-monthly meetings, and she helps to oversee the finances, activities, and helps to make decisions as a third-party representative. She also, in that way, helps to fund development of marketing teams, fundraisers, and help to raise awareness of all the good things that Healthy Baby Network does. In terms of quality assurance, she's the sole operator, so that really provides her with the ultimate transparency in business in terms of back-of-house activity. But in terms of working with her clients, she used to have a survey. If a client terminated their services, she would ask, maybe why they did that, if they felt as though they were heard, and she didn't really receive a lot of feedback on that. So instead, now she just tries to learn from each patient. How is she serving them? Are they feeling listened to? Is she helping them? And are their questions addressed? So now I'm moving on to my personal experience at Nutrition Care of Rochester. The practical activities that I really did was the remote work. Working on menus, sending out grocery lists, a lot of infographics, myth busting blog posts. I did a little bit of that, and then I did a lot of recipes. And I also did some visits. I visited Nutrition Care of Rochester, and I sat in on some client meetings, and then I also visited with Healthy Baby Network and interviewed them. So this is an example of a grocery list I did. I wanted to make it colorful. I wanted to make it pop. And Mandy said that for a lot of people, grocery shopping is a barrier to eating healthy because they don't know what to buy. So I decided to give them a list of things that are part of a balanced diet. And then I added a few extra lines so they can still add some things in. But now all they have to do is circle or highlight, and then they're good to go. So these are two recipes that I did. We have sheet pan chicken teriyaki with veggies, and then jerk chicken with fire roasted fresh pineapple. So Mandy said to find recipes that are fit for families, so quick and one pan meals. So that's like the chicken teriyaki with veggies. But then for both of them, they're pretty diverse, and with a lot of people who diet over and over again, on and off, they eat the same meals over and over. And so this provides them with some fresh and different meal ideas, such as the jerk chicken. That's not really that common. But now with this, they have flavorful and ethnic meals without eating away from home. So bringing the food into the home for some really enjoyable stuff. This is an example of a menu I did. My goal here was to have the goal and part of the meal plan is like a healthy weight. So having the goal at the forefront of the meal plan. And then based on this, working a menu around that. Because I think it should have a purpose. So other ideas could have been, muscle gain or fat loss or, if you're working out a lot. So it really depends on a lot. As you can see, I didn't put any amounts in there because you don't know how much someone needs. So, but just this is an example of how we can give them ideas and then we can adjust the quantities as needed. This was an example of a few infographics that I did. So I have first what's for dinner, and then picking your concept, veggies, grains, proteins, and flavors so that you can kind of build your own meal for people who have trouble figuring out what to eat for dinner. And then the second one I have here is healthy eating during quarantine. I did this after the COVID-19 outbreak and we had to do remote learning. So this was just some ideas on how to kind of manage a healthy weight while still accepting the fact that you can't really eat, exactly the way you can eat healthy not in a quarantine. So just managing that and still making healthy decisions in this time. And then the last one is eating on the go. So some tips and tricks to help you meet your goals while you're eating away from home. So you can still support small businesses, but then you can still eat healthy. Here I have a blog post that I did. So I did organic foods and cancer, uh, specifically, does it prevent cancer? And what was difficult about this was that I had to keep it between 400 and 700 words, which I never write that little. So it was really difficult to not only get the wording to be that in that small of a quantity, but also you have to make it readable and relatable to the reader. It's not the scientific community that's necessarily reading this. It's people who are interested in nutrition but are not exactly in the nutrition field per se. So making it relatable was really important to do. I also applied some concepts during this practicum experience. So the main one was nutrition research. I spent hours in the research rabbit hole, reading journal articles and looking at the EAL on the Academy of Nutrition and Dietetics website to find ideas for the blog posts. And the second thing I did was I had to look at the nutrition content of a lot of recipes. So for that, I had to do food processor for a lot of it. And then the third thing was nutrition education. Like I said, with the blog post, you have to disseminate the information, but in an effective way, in a way that people will understand. And the last part is groups helping underserved communities become healthier. That's just working with the Healthy Baby Network and understanding that they utilize research and they have to plan events and they have to make it so people will come and that people will listen to what they have to say. In terms of my preceptor mentoring and the reflection on that experience, it was really great to get a real world experience of how Mandy does it. So there was one girl that came in, she has binge eating disorder, and Mandy tried this new thing, and we did a mindful eating exercise, and each of us brought in some food, and we all practiced mindful eating. It was really, really exciting and really cool to do for the first time. Collaboration, working with Mandy, seeing what she wanted, some new ideas, new directions we can go in. That was really important. And then just having her show me a different option within the dietetic and nutrition field of working in a private practice was really great. Some personal growth during my experience. I was able to develop myself professionally, especially looking at the Healthy Baby Network and talking about how professionals can help with the diversity and inclusion when working with people of color, and how our biases can be detrimental for them trusting health professionals, and how we can curb that and being more sensitive to the cultural differences. The other thing was that material design. I never made an infographic, never made a menu, and this way I was able to do that, and it was really exciting. And then client communications, seeing Mandy work, 50% of it was just listening to the client, 25% was asking the right questions, and 25% was providing advice. But it was all based on what the client was saying and having them be heard. So thank you so much for listening. Good luck on all your future endeavors, and have a great rest of the semester.